Okay, so how are we going to treat a gallbladder attack or cholecystitis? Well, they can remove it, which is what they often do. They can do a choledocostomy to surgically create an opening into the common bile duct just for drainage if it just due to obstruction from a bile duct. An endoscopic retrograde cholangiopancreatography, which is a very, very kind of a very sophisticated procedure for removal of gallstones through an x-ray. And so they don't have to have through a tube. Anything that says endoscopic and graphy is x-ray through a tube. Low-fat diet to prevent attacks because a lot of it is brought on by a high-fat diet. And in vitamin K if they have itching and jaundice in the skin and bleeding tendencies due to a vitamin K deficiency. Usually, though, vitamin K deficiency is from liver, not gallbladder. Disorders of the gallbladder, the gallstones. Cholesterol stones form in bile that is supersaturated with cholesterol, and all kinds of different theories. Enzyme defect that increases cholesterol synthesis, a decreased secretion of bile acids to emulsify or break down the fats, a diminished reabsorption of bile acids from the ileum, gallbladder smooth muscle hypomotility and stasis. So why is it staying there? Stasis always means it's not moving. And hypomobility would be it's lost its movement capacity. A genetic predisposition, and we know that can go with anything. And then a combination of all of the above. All right, now moving on to pancreatitis. This is one of the most painful infections of the entire gut. Very inflamed area. I don't know if it's because it has so much blood in this organ, but it's inflammation of the pancreas associated with many other clinical disorders. It can be caused by an injury or damage to a pancreatic cells or ducts, causing a leakage of pancreatic enzymes into pancreatic tissue. But the enzymes, because there's very rich enzymes that come out of the pancreas, cause autodigestion of pancreatic tissue and cells, and it leaks into the bloodstream to cause injury to blood vessels and other organs. This can be acute or chronic. The manifestation is it's severe. This pain is severe. Epigastric high pain radiating to the back. It's not like gastritis. It's not like even colitis or Crohn's. It's a pain of 10 out of 10. A lot of times these poor people, the morphine is very hard pressed to help them. They can have fever and leukocytosis, just like with any other infection. Hypotension, hypovolemia. The enzymes that are so proliferative in this organ increase vascular permeability. It's characterized by an increase in a patient's serum amylase level. It's when it's sky high. It can be, I don't know, normal is low. It's somewhere around 20 to 40, and it'll be in the hundreds and sometimes thousands. A chronic pancreatitis over and over is, again, it's another one related to chronic alcohol abuse. Diagnosis, and usually, like I said, is serum amylase and lipase levels. Blood and urine glucose tests reveal transient glucose in the urine and hyperglycemia because we know the pancreas is going to, by the beta cells, it's going to release insulin to cover the glucose. Well, if it's sick, if the organ is sick, we may have a problem with that. So we're going to take blood glucose tests, a blood sugar, and we're going to look at the urine for sugar. Elevated white count along with serum bilirubin, but the classic is going to be the elevated serum amylase and lipase for pancreatitis. CAT scan and ultrasound, abdominal ultrasound is what they'll do. Will show an enlarged pancreas, sometimes with or without cysts. The treatment, we're going to give them IV fluids. They're probably going to be nauseous and maybe vomiting. Blood transfusions if they needed to replace blood loss from hemorrhage. Withhold fluid again, and reduce pancreatic enzyme secretion. Antibiotics sometimes. Insulin to correct hyperglycemia. Calcium gluconate to correct hypocalcemia. And they may need an NG tube to decrease stomach distension and suppress pancreatic secretions, just to keep that in check. And then I have some statistics for gastric cancer before we leave the GI dysfunction. And you can read through them. Esophagus is pretty rare. Stomach is rare also. Colon and rectum, though, are third most common cancer and cancer death in the United States, both men and women. 9 to 10% of cancers. And then you can see 95,000 new cases of colon cancer predicted for 2017. 39,000, and that's rising, of rectal cancer. So we have to look at what we're eating and what we're doing with our gut and if we're moving enough. Liver primary is rare, is again usually associated with colitis or Crohn's, or no, I'm sorry, that's colon. I'm sorry. Liver is associated with hepatitis and things that hurt the liver. And again, it's bolded to lower your risk for liver cancer, get vaccinated against Hep B, get tested for Hep C, and don't drink too much alcohol. Let's see, you guys can read through the rest. Although liver cancer incidence has more than tripled since 1980, but again, rates in young adults are a decline. It's liver cancer is not that common. Gallbladder is usually by metastasis from some other organ. Let's see. Pancreas, only for about 3% of all cancers in the U.S., 7% though of cancer deaths. You can read that one. And then I want to talk about irritable bowel syndrome before we go to. Didn't used to cover this one, but it's very common, more common than you would understand or know probably. It affects the large intestine. Signs and symptoms are almost anything you can imagine that go with the gut. It could be cramping, abdominal pain, bloating, gas, diarrhea, or constipation, or both. So IBS, it's a chronic condition that you'll need to manage long term. Only a small number of people with this irritable bowel syndrome have signs, severe signs and symptoms. Some people can control their symptoms by managing the diet, the lifestyle, and the stress once they figure out that this is happening to them according to stress and their stress level. More severe symptoms can be treated with medication and counseling. The important thing to note here is IBS does not cause changes in the bowel tissue or increase your risk of colorectal cancer, probably because it doesn't change the way the bowel tissue and cells look. Causes of IBS, it's unknown. Factors, though, that appear to play a role include muscle contractions in the intestine. The walls of the intestines are lined with layers of muscle that contract as they move food through your digestive tract. Contractions that are stronger and last longer than normal can cause gas, bloating, and diarrhea, which again are all symptoms of IBS. Weak intestinal contractions can slow food passage and lead to hard, dry stools or constipation. The nervous system. Abnormalities in the nerves in your digestive tract can cause you to experience greater than normal discomfort when your abdomen stretches from gas or stool from constipation. Poorly coordinated signs between the brain and the intestines can cause your body to overreact to changes that normally occur in the digestive process, resulting in pain, diarrhea, or constipation. And then good old inflammation, which we know if we have too much of it causes problems. Some people with IBS have increased number of immune system cells in their intestines. Why? Who knows? Severe infection. It can develop after a bout of diarrhea or gastroenteritis caused by a bacteria or virus. Might be associated with a surplus of bacteria in the intestines where there's bacterial overgrowth. And then changes in the bacteria in the microflora. Microflora are the good bacteria that reside in the intestines and play a key role in health. Research indicates that microflora in people with IBS might be different from the microflora in healthy people. So how are we going to prevent this? I mean, first of all, you have to know what triggers it. Finding ways to deal with stress may help to prevent or ease symptoms of IBS. They say the literature says consider counseling can help you learn to modify or change your response to stress. Studies have shown that psychotherapy can provide significant and long-lasting reduction of symptoms of IBS. Biofeedback it's always electrical sensors. The feedback helps you focus on making subtle changes, such as relaxing certain muscles to ease symptoms. Again, progressive relaxation exercises may even feed into the biofeedback. Help you relax muscles in your body one by one. Start by tightening muscles in your feet, and then concentrate on your ankles and your calves, and it goes all the way up the body. Next, tighten and relax your calves, and again, you get the idea. And then mindfulness. There's all kinds of talk and theory and people talking about mindfulness. What is that? It's that stress reduction technique that helps you focus on being in the moment, right here today. What am I doing today? And letting go of all other worries and distractions. We're just going to concentrate on Hervey's lecture for gastro problems today. That's what we're not going to worry about the next test. We're not going to worry about the test we just took. We're just going to concentrate on this. And it helps the body to not have to deal with all of those issues that we know that goes on when we do have stress. Okay, that concludes. You're thinking, oh, finally. And I will cover some of this in lecture. That concludes our lecture on the gastrointestinal tract disorders. And I hope you learned a whole lot. Take care, and I will see you soon. Bye-bye.